Hi, today I'll be dealing with a very familiar term that is hypertension. All of us, somehow or other, we have always come across this term high blood pressure or hypertension. And this is a vast subject, actually, hypertension. The reason being, hypertension is a lifestyle disease. In fact, this is not treatable. High blood pressure is not treatable, or rather, not curable, to be precise. There are two kind of things. One, if you have a disease that has to be treated, that can be cured. But if you have an illness that has to be managed, hypertension being a lifestyle disease has to be managed. It's an illness. So my first episode will be on hypertension. But because hypertension is a lifelong disease, I'd like to throw some more light on managing and preventing maybe hypertension. So that will be, quite a lengthy thing to cover up in one episode itself. Hence, I have divided it into different kind of episodes. Episode 1, I'll be dealing with hypertension. Episode 2 will be what high blood pressure can do to your body. Episode 3 will be surprising things that raise your blood pressure. Episode 4 will be tips to lower your blood pressure. And episode 5 finally will be foods that can lower your blood pressure. So straight away coming to the first episode, that is hypertension. Hypertension or high blood pressure is a common condition. The older you are, the more likely you are to get it. Blood pressure is the force of blood pressing against the walls of your arteries. This is how the exact pictorial representation goes regarding high blood pressure or blood pressure. Now, when your blood pressure is too high, your heart has to work harder. Understand this point. This is a very significant and important point. When your blood pressure is high, that means your heart has to work harder. This can cause serious damage to your arteries. Over time, uncontrolled high blood pressure makes you more likely to get heart disease, stroke, and kidney disease. Hypertension symptoms. What are the symptoms? High blood pressure is often called a silent killer because it doesn't always have outward symptoms. That means you could have it for years and not know even that you are already having high blood pressure. It can quickly damage your heart, your lungs, blood vessels, brain, and kidneys if it remains untreated. It's a major cause of stroke and heart attacks in the United States and the world over. What do the number mean actually? Whenever we come across the term blood pressure, certain numbers come into our mind. What are those numbers? Like 120 and 80. We'll understand it in detail. Now, before I go into the detail of these numbers, first we have to understand there are two kinds of pressure. One is called systolic pressure. That is the upper range of the pressure. Now, systolic pressure is measured between when the heart contracts. And then comes the lower number, that is the diastolic pressure. It is called diastolic pressure. It is measured between the beats when the heart relaxes. I think it's clear how the systolic and diastolic pressure is defined in medical terminologies. Now, what do the numbers mean actually? Normal blood pressure reading will fall below 120 by 80. 120 and 80, we are quite aware about this number. Higher results over time can indicate hypertension. The top number, that is the systolic, shows the pressure when your heart beats. The lower number, that is the diastolic number, measures pressure at rest between heartbeats when your heart refills with blood. Now, this is to be understood appropriately so that the clarity is there regarding what is blood pressure, what is systolic pressure, and what is diastolic pressure. Elevated blood pressure is always a warning signal or warning sign. Elevated blood pressure is consistently just above the normal level, anywhere between 120 and 129 for systolic pressure. Now, as we have seen, 120 is a level. Now, if one have an elevated blood pressure, it can range between 120 to 129. That will be an elevated blood pressure, and the diastolic will be less than 80. People in this range are more likely to get heart diseases than those with a lower reading. Your doctor may suggest lifestyle changes to help you get your numbers down. Exactly how do you define then blood pressure and what can be the ranges? As I said, when a person is having normal blood pressure, his blood pressure, that is the systolic, the upper pressure, will be below or less than 120, and diastolic will be less than 80. However, if he is suffering from elevated blood pressure, then the range he will be having is 120 to 129 for the systolic blood pressure, and it is less than 80 for the diastolic. This is called elevated blood pressure. Now coming to high blood pressure, actually high blood pressure can be in two stages. Stage 1, when the blood pressure or the systolic pressure of the person is ranging between 130 to 139, and the diastolic part of it is ranging from 80 to 89, he is having stage 1 high blood pressure. And then comes the stage 2, which is if the person's blood pressure or systolic pressure is ranging between 140 to 180, and the diastolic part, that is the lower part, between 90 and 120, then he is diagnosed to have stage 2 hypertension or high blood pressure. What comes then is hypertension crisis or hypertensive crisis. If somehow the systolic pressure goes higher than 180 and the diastolic goes higher than 120, then it is called hypertensive crisis. In such cases, consult your doctor immediately. The hypertension danger zone. If you have sorry, if you have stage 1 high blood pressure, if your systolic reading is between 130 and 139, or your diastolic is between 80 and 89, a reading of 140 or higher systolic or 90 or greater diastolic is stage 2 hypertension. You have you may not have any symptom even then. If your systolic is over 180 or your diastolic is over 120, you may have a hypertensive crisis, which can lead to stroke, heart attack, and kidney damage. Rest for a few minutes to take your blood pressure again and to recheck. If it's still very high, call for emergency. Symptoms include severe headache, anxiety, and your nose may start bleeding even. You might feel short of breath or pass out. Who gets high blood pressure? Up to age 45, men are more likely to have high blood pressure than women. Things even up as we grow older. And by 65, it's more common in women. You are more likely to get it if a close family member has it. It's also widespread among people with diabetes. But in most cases, the cause is not known. Sometimes kidney or adrenal gland disease can bring it on. Race plays a role too. African Americans are more likely to get hypertension and at a younger age. Genetic research suggests they are more sensitive to salt. Diet and excess weight make a difference too. Consequences of high blood pressure can be serious. It can include stroke, it can include heart failure, sexual dysfunction, kidney failure, or even vision loss. Say no to sodium, or at least watch how much you get. This building block of salt causes your body to retain fluid. This puts a greater burden on your heart and boosts your blood pressure. Aim for less than 2500 milligrams of sodium per day. You will need to check nutrition level and menus carefully. What is the exact salt content? Processed foods make up the bulk of our sodium intake. Canned soups and lunch meats are prime suspects. Get a handle on stress. It can make your blood pressure spike. But there is no proof stress keeps it high long term. To manage it, stay away from unhealthy things like poor diet, alcohol use, and smoking. All are linked to high blood pressure and heart diseases. Drop those extra pounds. They put a strain on your heart and raise your odds of having high blood pressure. That's why diets designed to lower blood pressure also aim to control calories. You will cut out fatty acids and extra sugars while adding fruits, vegetables, lean protein, and fiber. Even a 10-pound weight loss can make a difference. Cut back on booze. Too much alcohol can boost your blood pressure. Limit drinks to no more than 2 a day for men and 1 for women. Now, how much is that? 12 ounces of beer, 4 ounces of wine, 1.5 ounces of 80 proof spirits, 1 ounce of 100 proof spirits. Caffeine is okay. It can make you jittery. So, does caffeine also raise your blood pressure? That's a question. It might for a little while, but there is no link between caffeine and hypertension. you can safely drink 1 or 2 cups of coffee a day. Moms to be can get it. Gestational hypertension or hypertension during pregnancy can affect women who have never had high blood pressure before. It usually happens in the second half of pregnancy. Without treatment, it may lead to a serious condition called preeclampsia. This limits blood and oxygen flow to your baby and can affect your kidneys and brain. After delivery, your blood pressure should return to its normal level, but it is possible for the condition to persist for several weeks. Medication might bring it on. Cold and flu medicines with decongestants are one of the several classes of medication that can raise your blood pressure. Others include NSAID painkillers. NSAID is non-steroidal anti-inflammatory drugs, in simple language, pain relievers or painkillers, then steroids, diet pills, birth control pills, and some antidepressants. If you have high blood pressure, ask your doctor if any drugs or supplements you are taking could affect your readings. Your stress can cause it. You may have a high reading only in the doctor's office. This is very, very interesting. This is probably due to nerves. When you find yourself in a doctor's chamber and doctor is taking a pressure, you can find a higher number. You might have one only every now and then. This could mean you are more likely to get high blood pressure later. For a more accurate reading, take your blood pressure at home, chart the results, and share them with your doctor. Bring your home monitor in the chamber so the doctor can check the device and your techniques. It can affect kids. It's more often a problem for older people though, but children can also have high blood pressure. What's normal varies based on a child's age, height, and sex. Your doctor will need to tell you if there is a concern. Children are more likely to get it if they are overweight or obese, have a family history of the illness, or are African American. Try the DASH diet. What is DASH diet? You may be able to lower your blood pressure by eating better. The DASH diet stands for Dietary Approaches to Stop Hypertension. Calls for more fruits, vegetables, whole grain foods, low fat dairy, fish, poultry, and nuts. Steer clear of red meat, saturated fats, sweets. Cutting back on sodium in your diet can also help. Get more exercise. Regular activity helps lower blood pressure. Adults should get about 150 minutes of moderate intensity exercise every week. That could include gardening, walking briskly, bicycling, or other aerobic exercises. Add in some muscle strengthening at least 2 days a week. Target all your major muscles groups, and then diuretic, get rid of extra water. Diuretic is one kind of medication, also called water pills. They are often the first choice if diet and exercise changes are not enough to bring down your blood pressure. They help your body shed excess sodium and water to lower blood pressure. That means you will pee more, you will go to the toilet to urinate more. Some diuretics may lower the amount of potassium in your body. You might notice more muscle weakness, leg cramps, and fatigue as a consequence of this. Others can boost blood sugar in people with diabetes. Erectile dysfunction is a less common side effect with diuretics. Beta blockers slow things down. Beta blocker is one more kind of medication. These drugs slow your heart rate. This is important to understand. These drugs, that is beta blockers, slow your heart rate, which means your ticker doesn't have to work hard. That is, your heart will not have to work hard. They are also used to treat other heart conditions like an abnormal heart rate or arrhythmia. Your doctor may prescribe them along with other medications. Side effects can include insomnia, dizziness, fatigue, cold hands and feet, and erectile dysfunction. ACE inhibitors or angiotensin converting enzyme inhibitors open things up. These medications lower your body's supply of angiotensin 2, a substance that makes blood vessels contract and narrow. Now, this is important. Blood vessels contract and narrow. Now, the result is more relaxed, open arteries as well as lower blood pressure and less effort for your heart. That is, these medications, ACE inhibitor, will ensure more relaxed open arteries as well as lower blood pressure and less effort for your heart. Side effects can include a dry cough, skin rash, dizziness, and high potassium level, those who are having ACE inhibitors. Don't get pregnant while taking one of these drugs is a precaution. ARBs keep the flow going. Instead of lowering your supply of angiotensin 2, these drugs block receptors for angiotensin. It's like placing a shield over a lock. This blockade prevents the chemical's artery tightening effects and lower your blood pressure. ARBs can take several weeks to become fully effective. Possible side effects include dizziness, muscle cramps, insomnia, and high potassium levels. Don't get pregnant while taking this medication. Calcium channel blocker is another kind of medication that slow the beat. Calcium causes stronger heart contractions. These medications slow its movement into the cells of your heart and blood vessels. That eases your heartbeat and relaxes your blood vessels. These medications can cause dizziness, heart palpitations, swollen ankles, and constipation. Take them with food or milk. Avoid grapefruit juice and alcohol because of possible interactions with calcium channel blockers. Other medications can help too. Vasodilators, alpha blockers, and central agonists also relax blood vessels. Now, these are certain medications which your doctor know the best, but if you are on these medications, you should remain then. You should remain aware about the same. Side effects can include dizziness, a fast heartbeat, or heart palpitations, headaches, or diarrhea. Your doctor may suggest them if other blood pressure medications don't work well enough or if you have another condition. Complementary therapies are an option. Meditation can lower blood pressure by putting your body into a state of deep rest. Yoga, Tai Chi, and deep breathing also help. Pair this relaxation technique with other lifestyle changes like diet or exercise. Be aware that herbal therapies may conflict with other drugs you take. Some herbs actually raise blood pressure. Tell your doctor if you take herbal or other dietary supplements. Living with high blood pressure, hypertension is often a lifelong condition, as I already have mentioned during the initiation of the presentation. It's important to take your medication and continue to monitor your blood pressure. If you keep it under control, you can lower your odds of stroke, heart disease, and kidney failures. That was about the first part of my presentation, first episode on hypertension. However, the second episode will be on what high blood pressure can do to your body, which I'll be coming out soon with. Thanks for watching the first episode of high blood pressure. Hope this educational info is useful to you. For more such informative, relevant, useful, then helpful practical medical tips for you and your near and dear ones, please subscribe to the channel. The subscription button will be on the right hand side corner of your screen. And before I sign off, today's laughter dose. Yes, I would like to have this kind of a part, and in fact, who would not like? Thank you for watching. See you soon with